Good evening. My name is Charlene Dukes, and I'm the president here at Prince George's Community College. Thank you. On behalf of the college, I certainly want to thank you for attending this very important town hall meeting to discuss the need for health care reform. I especially want to thank Senator Ben Cardin for leading this effort, as well as Dr. Donald Schell, who heads the Prince George's County Health Department. And with us tonight, we have a few other dignitaries that we'll continue to announce, certainly as we move through the program. First, I'd like to acknowledge Nicole Schultz, who is here representing Senator Mikulski, Mr. Terrence Taylor and Ms. Betsy Bossert, who are representing Congressman Hoyer, Mr. Julius West, who is representing Congressman Van Hollen, and Chonya Davis Richardson, representing Congresswoman Edwards. We also have with us Senator Doug Peters from District 23, Delegate Herman Taylor from District 14, we have Delegate Joanne Benson from District 24, and Delegate Michael Vaughn from District 24 as well. We also have joining us Mayor Darrell Miller from Capitol Heights and Mayor Eugene Grant from Seat Pleasant. And we have a whole host of other dignitaries in the room, you, the public. Thank you so much for being here. We are honored here to serve as a resource for Prince George's County and the region, where you are welcomed and encouraged to communicate your views, your concerns, and issues affecting our communities. Healthcare certainly ranks among the top in these issues for discussion. And this evening, please understand that while there is much to discuss, what we will be talking about tonight will be healthcare. And notably, the most visible need and sign for healthcare reform is the 46 million Americans who are currently without health insurance. This projection was recently presented by President Obama's Council of Economic Advisors in June. That number is expected to increase to 72 million in the year 2040 if we do nothing. According to a 2005 U.S. Census Bureau report on health insurance estimates, more than 23% of residents age 18 to 64 in Prince George's County did not have health care insurance coverage. This was higher than any other county in the state of Maryland. So I personally want to thank Senator Ben Cardin on behalf of the 41,100 students that we educated annually this past year at Prince George's Community College for bringing this healthcare town hall meeting to Prince George's Community College and for seeking input from the residents of our great county. Before I introduce Senator Cardin, please allow me to address a few housekeeping rules. First, and I've mentioned it before, this is a healthcare discussion only. And if other topics are brought up, we will move on to the next question. We'll thank you for your question, but it will not be answered. Secondly, due to the size of the audience, everyone may not have an opportunity to ask the question. However, you can send your questions directly to the senator by accessing his website at www.cardin.senate.gov, and you click on the Contact Senator Cardin link. You can also review the handout that was available for each one of you this evening at your seat. And if you did not receive one, you can pick one up at the table as you exit later on this evening. As you all know, Senator Cardin has been a national leader on health care, retirement security, the environment, and fiscal issues coming to Congress since he came to Congress in 1987. In 2006, he was elected to succeed Paul Sarbanes in the U.S. Senate. Prior to that, Senator Cardin represented Maryland's 3rd Congressional District in the U.S. House of Representatives. He served in the Maryland House of Delegates from 1967 to 1986 and as Speaker from 1979 until 1986. During the 111th Congress, Senator Cardin was successful in getting guaranteed dental benefit included in the reauthorization of the Children's Health Insurance Program. He is a graduate of the University of Maryland School of Law, and he earned his bachelor's degree from the University of Pittsburgh, and we are alums.
Oh.
Yes, we are. So we have a lot in common. We're interested in healthcare reform, and we graduated from the University of Pittsburgh. So we are very fortunate to have him with us this evening, and we look forward to this discussion again on healthcare. So please use this opportunity to learn, to ask questions, and to make your voices known. Please join me in welcoming Senator Ben Cardin.
So, Dr. Dukes, what's the subject tonight? Healthcare, okay. I think we have enough to talk about, so I think we'll be able to have a very, I hope, productive evening tonight at this town hall meeting to talk about healthcare. I want to thank Dr. Dukes very much for her leadership here at the college. It's a great asset for our community and for the county. I know that Jack Johnson is going to try to get here sometime tonight, but I want to thank him for his priority in healthcare in Prince George's County. And thank you, Dr. Schell, for being here to help us understand what's happening on the ground here in Prince George's County and the challenges that you face in trying to provide health care for the people of this nation. Let me just sort of give you what I hope we can accomplish. I want to hear what's on your minds tonight. So I'm going to give a very brief summary of where we are in the Congress of the United States. We're at the first stages of the discussions of health care reform. We've had several of our committees start to act on health care reform. There are many committees that have not acted yet. In the United States Senate, the Senate Finance Committee, which is a critical committee to the health care debate, has not had a markup yet. The Senate Health Committee has, and they've reported out a bill. We can talk a little bit about what's in that bill. We had 3 committees in the House that work on health care reform. There are major differences between the different committee bills, and these have yet to be reconciled. So we are still very much in the early stages of health care, and I want to hear from you as to your thoughts and at least fill you in on some of the things that we're talking about. Make no mistake about it, health care is a priority of the Obama administration. Health care reform is a priority of the Congress. We've already seen in 2 major bills that have passed in the early days of the Obama administration how health care has been a priority. In the American Recovery and Reinvestment Act, there was $21 billion that was put in COBRA protection for those who lost their jobs, government helping them keep their insurance even though they lost their jobs. $19 billion in health information technology to try to bring us in to modern times and using technology not only to save administrative costs, but to help manage care more effectively by information being available about you for your treatment. There was $1 billion spent in wellness and prevention programs in the Recovery Act, $10 billion in biomedical research, money for community health centers, money to try to look at better ways of getting better health care results. So there was a priority on the recovery bill for health care. And then this Congress passed the Children's Health Insurance Program. I mention that whenever I'm in Prince George's County because this county, with the Monty Driver, understands the importance of children having health care needs met. We not only expanded the number of children that will be covered by the Children's Health Insurance Program, but we included as a required coverage dental care. So we have made progress. We have made progress to date. Now, the big issue is what do we do about our overall system? Dr. Dukes has already covered some of the major challenges. President Obama has laid out the parameters of a plan that says we're going to build on our current health care system. We're going to take what's right and we're going to keep it. So if you are satisfied with your current health care coverage, the plan will guarantee you the ability to continue your current health care coverage.